Since time immemorial, disabled persons have been an integral part of humanity. In our society, due to a lack of awareness, disability was considered a curse, and disability at birth was viewed as a matter of destiny. Over the years, this attitude has shown a positive change, and disability has been accepted more as a challenge. Let us try to understand disability in all its forms.
Disability means, in simple words, inability to be able to perform such actions and functions which an average person can do. For instance, if a person cannot see or he cannot hear, then he's got a disability related to the senses of vision or hearing. To some extent, we are all disabled. For instance, I am wearing spectacles, and without that, I cannot see as well as some of our other friends can do. But then this means that spectacles have remedied my deficiency of eyesight. So it has not been allowed to become a handicap. So this is a very good example of how a disability or a potential disability can be taken care of and not allowed to become a handicap. This has to be ultimately our objective while dealing with people who have any form of disability.
Disability is essentially the loss of functions or the impairment of the functions of the body with which the person is not able to perform his activity of daily living. When we talk about the activity of daily living, it matters to the self-care. For example, the person is not able to take care of himself. He may not be able to brush his teeth. He may not be able to clean himself. That is the activity of daily living. Simultaneously, he cannot participate socially. Yes, because he is not able to move, he cannot see, he will not be able to participate in the society itself. The most important issue among all these things in the disability is that if he is not able to earn his livelihood, that is, he is not able to economically viable for himself, for his family, for his society, the person is eventually disabled.
Disability can be classified into various categories, namely orthopedic disability, visual disability, hearing and speech disability, mental disability, and multiple disability with a combination of 2 or more disabilities. For formulating a meaningful disability control plan for our society, it is imperative that we must know the prevalence of disability existing in our country.
If all types of disabilities are totaled up, almost 10% of children will be found to have some disability or the other. 2% roughly may have mental retardation, another 2% may have something like deafness or hardness of hearing. Then there are children who have spasticity and cerebral palsy, and many others have learning disorders and newer items like autism. They are being diagnosed more and more often.
Let us get to know the causes for various disabilities one by one.
In the adults, we have a very high accident rate, both at work as well as on the roadside. And these lead on to severe disabilities. In Punjab, in the agricultural sector, we often find that the hay choppers chop off the arms of poor laborers who are working at them.
In my 30 years of experience in the field of disability, working with orthopedically disabled persons by fitting them artificial limbs, I've come across over 65,000 patients who have been fitted with artificial limbs at Navedak Prosthetic Center. What we have seen that the patients, once they are fitted with artificial limbs, they are, even if they are considered to be disabled, they are not disabled or handicapped. The word used for them is now physically challenged or differently abled persons. They are definitely abled persons. And the example is that in my own institute at Navedak, we have employed about 25% of persons who are suffering with one disability or the other. They are doing their work with the help of the artificial limbs, and their performance as compared to the so-called abled persons is equal or maybe much better than what a normal person is doing.
The main causes of blindness in our country is cataract. In 60% of the blinds, it is the cataract which is the cause. Fortunately, this cause is a reversible cause. Because of the newer technology, the phacosurgery which is being adopted by most of the surgeons, this blindness is reversible. The vision can be brought back. The other second cause in the age group of 50 to 60 years is glaucoma, जिसको आम भाषा में काला मोतिया कहते हैं. This blindness is unfortunately irreversible, and sometimes this is diagnosed once the patient comes to the eye specialist. Therefore, it is very, very important that after 50 to 60 years of age, the patient should come to the ophthalmologist or eye specialist so that the disease can be diagnosed and can be treated early so that the damage can be stalled. The third cause is refractive errors, that is, persons requiring spectacles and not using spectacles. And if the spectacles are worn, the vision again is brought back. The fourth is the corneal blindness. For that, eye banking is required. Somebody dies, he donates his eyes, the vision after surgery can again be brought back. The fifth important emerging cause of blindness these days is because of our lifestyle. We are becoming lazy and we are getting more and more people diabetic and hypertensive. And these two diseases, they have their toll. They affect the eye and cause diabetic retinopathy, cause hypertensive retinopathy, cause blockade of the vessels. And so they are the emerging cause of blindness as we see in developed countries. In addition, there are certain children, those who are blind right from birth. It is termed as congenital blindness. The common causes are that the eye is not formed at all, and if sometime the eye is formed, you see they are having nerve which is not healthy. The nerve forms connection between the eye and the brain. The third is sometimes you have congenital cataract, congenital glaucoma. Fortunately, both these two conditions can be diagnosed early, and these problems because of the cataract, congenital cataract and congenital blindness can be looked after.
Hearing is an important part of our life, and this is possible with the help of ear. Once the ear is diseased, you can have a hearing loss. The hearing loss can be conductive type or sensorineural type. The sensorineural type of hearing loss can be before birth, during birth and after the birth. In this case, the baby who is born will have a congenital type of hearing loss. Once he is born with hearing loss, he will not be able to interact with other people and he will not be able to speak. That's why we call it as a deaf and dumb in fact. This hearing loss can be treated by certain medicine if it is conductive type, or operation can be done if the tympanic membrane is perforated. But the sensorineural type of hearing loss can be helped by hearing aids. Various types of hearing aids are available. Only hearing aids will not be suffice, you will have to go for some therapy also. But in certain cases where the hearing aid is not helpful, we can go for surgical procedures, that is cochlear implant. This cochlear implant is now being done in India also regularly in different parts. With the help of cochlear implants plus the therapy, the patients can be benefited, and once the patient is benefited, we can put him into the normal life.
A mentally retarded child or a person is one who has a limited intellectual capacity as compared to a normal person. It basically means that this person has limited power to understand things, to take decisions and to carry forward. Let me here clarify that it is not an illness, it is a condition. Like all of us has different heights, different weight, different looks. So similarly the God has given different level of understanding to different persons. Some people are genius, some people have a limited capacity, and some people have very low capacity to understand things. In terms of IQ, generally we take a person having less than 70 IQ is generally taken as a mentally retarded person. And then we have further subgroups like person having 50 to 70 IQ, we say that they are mildly retarded. And the other group is 35 to 50, we say moderately retarded, 25 to 30, severely retarded, less than 20 is profoundly retarded. So this is what we say mental retardation.
With a view to control the problem of disability, the government has taken a number of initiatives for the rehabilitation of disabled persons. Many non-governmental organizations have also come forward to support these initiatives.
As Commissioner of Disabilities, my efforts have been to kind of encourage disabled people to ask for their rights. You see, it's no favor to a disabled. We are not trying to sort of be merciful to them, definitely not. There is an act, and for the first time in the history of our independent nation, an act came where there are certain obligations of the government that they must discharge for the welfare of disabled. Simultaneously, there are certain rights of the disabled which they must ask, demand from the government or the state or the society for that matter at large, that they must get their rights.
For the removal of architectural barriers, MHRD has issued guideline document, and we have adhered to that document. In this institution, we have provided facilities in the corridors, in the toilets, in the bathrooms, in the rooms of hostels for such students, and in the academic blocks, in the toilets and corridors. These students cannot move unless we provide such facilities to them. Even they cannot climb to the ground level unless we have the ramps. So such like ramps have been provided in all the hostels where such students reside and in all the academic blocks where they go for study. We have also provided the interconnection, the ramps between the blocks.
The Government of India has been very conscious of looking after the disabled and the needy. However, in this regard, the non-government organizations have also a large role to play. They are actually close to the people and have at times gone through, people have personally gone through the trauma, and they can as such devote themselves more intimately to the needs of the needy.
Since 1981, Government of India has come up with a scheme known as ADIP scheme, AIDS and Appliances scheme, which is being given to the recognized institute. And with this, any person who is having income of less than 5,000 rupees per month is entitled to free treatment.
The main problem faced by visually handicapped students is of mobility. It's very difficult for them to go from one place to another since they are sightless. To cover up this problem, we have got specially trained teachers who give them training in mobility so that they may not face any problem of posture and gait from going from one place to another. If this problem is covered up, then they face no difficulty. The other problem is of reading and writing. To cover up this problem, we give them training in Braille script. That is a special script for the blind. And when they are fully trained in the script of Braille, they can read and write in that script. That is a mounted script. When they put the tips of their fingers on those dots, they get the form of words and sentences. Though when they are to appear in public examination, they are not allowed to write in Braille. There is a special provision of providing them writers of one class lower.
Senses are the gateway to knowledge, and when person becomes visually handicapped, either he is a congenitally blind or adventitiously blind, it is our endeavor to develop, to create confidence in him, because where there is a will, there is a way. Blindness is not a curse. Blindness may be an impediment, but this impediment can be overcome by confidence, creative activities, education, because no gold, only education can make man wise and strong.
So our aim of the education is broad-minded, improve their capability to comprehend the various subjects that they have to learn, teach them values of life, character building, because the problem that they will face in life can be solved only by imbibing very good character.
One of the most important aspects of rehabilitating a disabled child is to give him proper and suitable education. Therefore, it is necessary to quickly equip him with the education that he is ready to receive or is able to receive. These days, the old-time methods are being used in all the educational institutions, which are time-consuming, while we have educational technologies these days which can hasten this process a lot, which can develop more concepts in the minds of the children very, very fast. And developing these educational technologies, particularly based upon the modern science and equipment which is available, should be our priority. And if that is used for educating such children, we can achieve a lot more than what we are able to achieve today.
In the beginning, we started the school with 20 children. Gradually, the number of children has gone up to 75. In the beginning, stress was laid on stitching and academics only. Later on, we have added more vocational training to the children.
Our schools, whereas the world over, there is integration in the schools where the handicapped are equally welcome. To this extent, there are very few educational institutions in our part of the country or in our part of the world who are meeting these requirements as yet.
To my knowledge, physically handicapped, blind and deaf and dumb can take care of, if trained, themselves and their families. But I'm dealing with the mentally handicapped children. I consider these children really disabled. They cannot think for themselves, they cannot do all the jobs required either in the vocational or academics independently. Their number is 3% of the population, which to my knowledge is very large. Something very great has to be done for them. First, awareness in the society. Awareness and realize the responsibility of the various organizations, including the government. I think this should be responsibility of every Indian citizen to look around and help in whatever way they can, contribute to the improvement of the mentally handicapped children so that society accepts them and the parents and the children are a happy lot and part of our mainstream.
Most disturbing thought which comes to their mind is that who will look after the children after their death? That was the most haunting thought they keep on getting. There is an act called the National Trust Act. This act has provided some relief, and I think this is the most important achievement in the recent past in the area of the mental retardation, because this act has provided a relief to the parents. Now there is a trust, and this trust will look after the children once the parent become the member of that trust. The government of India has already given 100 crore for that trust, and this money has been invested, and out of that investment the families, the parents are being helped, and this trust will look after the children even after their death. That means each state is going to have the home, the respite care centers where the children will be looked after by the trust.
If we wish to reach up to the disabled person, it is desired that we must talk the same issues with the paramedics. We must talk the same issue with some person, those who are moving in the society, and they are known as community-based rehabilitation workers. So in this state source center, we have trained the doctors of the city of Chandigarh, and simultaneously then we have trained all the paramedics in Chandigarh and community-based rehabilitation workers. These community-based rehabilitation workers, they are capable of identifying a disability at the doorstep of a disabled person.
Sometimes it's seen that either it is expected too much from a handicapped, from the parents. They expect from him that he should do everything like their other normal children. They feel that it's just the delayed milestones. There's nothing wrong with the child, it will be okay after some years. And it is what they are guided by, sometimes by the doctors and other professionals of the society. And when their expectations are not fulfilled, they are quite grieved. Then they think that the child is useless, just can't do anything. It is the other extreme stage. Because they don't realize that if the child cannot do 80 things in his life, there are certain 20 things that the child can do very well. And we have to see what are those things. We have to encourage the child into those things, give an outlet to those qualities.
Tackling the problem of disability is a massive task. Government and other organizations cannot do enough for the welfare of these people without the active support of the families and the society.
In the management of disability, the earlier the defect is diagnosed and the earlier treatment is started, the better the results will be. It is certainly worth emphasizing that time lost is lost forever, and a delay in the treatment can damage a person in an irreparable way. I would like to urge the parents of children who have some disability or the other that they should realize that they are the only hope and support of the child. If they lose their heart and feel discouraged, then the child will not get the benefit of effective treatment for the duration that he needs, because they are then prone to give up halfway. Therefore, persistence in treatment at a center where knowledgeable and experienced people are working in the disability field would be ideal, so that we can help the child to attain his potential. After all, parents of a normal child also are trying to do the same.
I wish to request all citizens that they must not consider disabled as destitute or a liability on themselves. They do not require your sympathy, they just require your help to stand in the society parallel to you and equal to you, and for that they need to be supported in terms of emotional support, a physical support, and then vocational training like that, so that they should be able to take care of themselves, they should be socially interactive, and they should have a economic independence.
I'd like to request all the parents who has such a child in their family, they must accept this child. And let's not deny that this child is mentally retarded, because this denial gets the sort of lot of delay in seeking help. And it has been seen that children who come to us at an early age, they become more independent, their speech develops very well, and they become more productive. So this child must reach to us as early as possible.
I feel that the mentally challenged people of our society must be accepted by everyone with love and care, and not with pity and sympathy, because we must remember that no one in this world is perfect.
The parents have to play a very vital role in the rehabilitation of their disabled children, and most of the time they are found wanting. They try to save money to leave behind and do not care to spend money for their education and training in life. If you can educate a deaf child or a disabled child and make him stand on his own legs, it's far better than leaving behind that money you will spend on him. And that is a mistake which most of the parents do in India.
If society cultivates positive and very healthy attitude towards the visually handicapped, definitely he or she will obtain or gain the expectation laid down by their parents, society, peer group and community.
It has been observed that disabled persons with their courage, grit, determination, hard work and their inherent talent have won the adoration of society. Their unbelievable achievements have led the people to a more positive outlook towards disability. The hope remains alive as long as these differently abled persons continue not only to fully explore their own potential in different areas for their livelihood, but also merge in the mainstream of life.
When Vivek was 3 months old, I could learn from the doctor that his hearing is totally impaired. He got award from the teacher as the best behaved boy on the very first day when he went to the school. His interest for working with the technical things like handling the instruments and also coming to the workshop, and he was very keen observer, and now he is managing the complete workshop inside. He is efficient at performing the mobile phone SMS communication. He is very good at car driving and drives very precisely and at the same time maintaining a coherence in speed.
मैं BBMB रेस्ट हाउस में टेलीफोन ऑपरेटर के पद पर कार्यरत हूँ। मैं लगभग 51 तरह की एक्सचेंजों पर कार्य कर सकता हूँ।
तो हम इसका फूल बनाने के लिए और इस साइज का हम फूल बनाएंगे तो 1 मीटर में हमारे कम से कम 25 पीस निकल जाते हैं, और इसे बड़ा बनाना चाहें तो 15 या 20 पीस ही निकलेंगे। तो जैसे आपने देखा ये पीस हमने बनाए, रेडी किए हैं ये, और ये कुछ बने हैं, ये कुछ क्रेप पेपर के हैं। तो जैसे इसको मार्केटिंग करना है तो मेटेरियल हम सारा कुछ खुद ही खरीद के लाते हैं और मार्केटिंग करने के लिए खुद चले जाते हैं।
मेरी ये प्रॉब्लम हाथों की जो है ये बचपन से ही है, और करीब मैं 7-8 साल की थी तो स्कूल में जब मुझे एडमिशन के लिए ले जाया गया तो सभी स्कूलों में मुझे एडमिशन नहीं मिली, बिकॉज उनका कहना था कि जो लड़की हाथों से लिख नहीं सकती वो कैसे स्टडी करेगी। तो एक निराश होकर घर पे आ गए, और एक दिन मैं अचानक मिट्टी में कुछ बना रही थी, घर और पैरों से स्टापू वगैरह बना रही थी। तो मेरे मम्मी और दादा जी ने देखा, बिकॉज वो घर पे थे, तो उन्होंने कहा कि अगर तुम ये बना सकती हो तुम लिख भी सकती हो। तभी मैंने पेरेंट्स से लिखना शुरू किया और फिर मुझे एडमिशन मिली। उसके बाद मैंने पब्लिक एडमिनिस्ट्रेशन में एमए की ही और 1 ईयर इंडियन क्लासिकल म्यूज़िक में डिप्लोमा भी किया हुआ है और बेसिक कैबिन क्रू की ट्रेनिंग की है जस्ट नॉलेज के लिए, और ग्लोबल डिस्ट्रीब्यूशन AFA टिकटिंग का भी कोर्स किया हुआ है मैंने। और अभी मैं वेब डिज़ाइनिंग सॉफ्टवेयर इंजीनियर का कोर्स कर रही हूँ, एक कंप्यूटर में और एक O लेवल का कर रही हूँ। साथ में मैंने इंडियन क्लासिकल म्यूज़िक और लाइट म्यूज़िक भी ज्वाइन किया हुआ है अभी, और एक पैरों से मैं कथक सीख रही हूँ, जस्ट ये मेरी हॉबी है। तो ये मेरी अभी क्वालिफ़िकेशंस हैं। साथ में एक स्टडी बूथ भी रन कर रही हूँ।
नहीं है दृष्टि तो जीवन यूं न गंवाएंगे, मन की आँखों से दुनिया नई सजाएंगे, अंधकार में जीवन को दीपों से सजाएंगे, ज्योति पास नहीं तो क्या दिल का दिया जलाएंगे।
मैंने फ्यूचर में अच्छा आर्टिस्ट बनने का ख्वाब देखा है और मेरी एडमिनिस्ट्रेशन मेरी मदद कर रही है, और हमारे यहाँ की देव समाज कॉलेज की और एक और मैडम है जो प्रोफेसर हैं आर्ट्स कॉलेज की, वो हमारे पास आएंगी, हम उससे लर्न करेंगे, सीखेंगे। वैसे मैं अब कार्टूनिस्ट बनना चाहता हूँ और मीडिया से जुड़ना चाहता हूँ।
1982 में मेरा एक्सीडेंट हुआ 15 अगस्त, और उसके बाद मेरी ट्रेन में दोनों लात कट गई और यहाँ पर आर्टिफिशियल लिम्ब सेंटर में आया, मैं लेग लगवाया और चलने फिरने लगा, और घर में भी आता जाता हूँ और कोई प्रॉब्लम नहीं होती मेरे को, और इधर दूसरों को भी लेग बनाकर मैं देता हूँ। इस टाइम मैं इस जॉब में हूँ लिम्ब मेकर।
हमें ये लगता था कि मौत ही आ जाए, ज़िंदगी है तो क्यों है, लेकिन अब लगता है करने को बहुत कुछ बाकी है अभी, ज़िंदगी तो इतनी छोटी क्यों है।